So it's, you know, it's interesting how we use that term, the last mile, right? This medical countermeasure thing, and now it's the last mile plus. So I was describing earlier today, I've had the displeasure of running 4 marathons in my life. Now, displeasure I say facetiously because somehow I kept going back. And they always describe the marathon as a 20-mile training run followed by a 10K. And that's sometimes how you analyze things. And for me, it was always that last mile that was always the most exhilarating, because by then you kind of know that you're going to make it. By then you also feel the pain, but it's somewhat diminished by the idea that somewhere out there is an ending point. And when that ending point happens, you can actually stop the foolishness of running for the 3+ hours, 4+, whatever it was. So we're at that stage right now. So the end point is out there. We have like 200 meters left to go, and we're all kicking, right? But that being said, first and foremost, I want to congratulate this group for everything you've done. As humbled in the position of being the chair of the planning committee, it was a pleasure to finally see the faces that I've heard on the phone for the last several months. This is always a difficult endeavor, right, to put something like this together. And again, kudos to the planning group, to the staff from the National Academies, who, you know who you are. I'm told I can't mention you by name anymore, Justin and Alexa and everybody else out there. To the sponsor, I can't say thank you because you've done your own thing, but obviously the sponsor does an important role in terms of bringing this concept to mind, and certainly to you, Laura, for everything you've done in terms of making this move along. So that's, in essence, the thank you, except for the most important group, and that's the people who came and spoke openly at this. You know, it's one thing to be on the planning committee and you kind of say, okay, yeah, we kind of got co-opted into this. I signed my life away, and I'm sure there were times where you say, oh man, I don't have the time to do this. The consultants are always happy because they're helping us, but they also are doing this for other reasons. The National Academy people, this is what they do for a living as well. But for everyone else who takes time out of their schedules to basically say, I'm here to play an important role in providing information or to learn. I always learn at these things, no matter how much it's a service, right, Eva? You provide a service by bringing your thoughts to their process, but each and every day we learn something. And I talked about yesterday the commencement speech I gave at my daughter's graduation. And amongst the 5 hats that I wore, and I did wear each one of them as a prop, was my dean's hat, you know, and that's sort of the, you know, the academic regalia hat. It looks like a goofy hat, but I love it. I wear it to work every day. I used to wear the Public Health Service Commission Corps uniform. Now I wear robes and the funny hat. Why? Because I'm dean and I can. But I mentioned yesterday how, you know, part of our lives, and one of the positives of these sort of get-togethers is we learn. And I stress to the young women graduating from high school yesterday, you never stop learning, right? Einstein here had a quote, and he talked about the idea is that you commence learning at birth, and it ceases at death. And that's the way we look at this. That might be a morose way of looking at this. I look at my friend Paul Seligman, who knows the fact that 6 weeks ago, based upon his tutelage, I relearned at the age of 57 how to properly tie my shoelaces. Okay, for 57 years, I have lived a lie. And when Paul told me that I was doing the granny knot as my first step and not the square knot, and that became evident to me because my shoelaces kept untying for 57 years, -5 or so, I can blame Mrs. Demetrius, my kindergarten teacher, but in essence, at the age of 57, I forced my hands to do something different for the betterment of mankind and myself. But we all learn something from this, and I think we walk away with that positive. Now, what are the next steps? Well, next steps of this are more difficult to discern, right? We have solutions we came up. Not recommendations, we have solutions we come up. Do you feel good?
Really good.
Okay, he feels really good, and as you know, I was deathly afraid that he would be disappointed today. And after all this work, we have these solutions. We get these proceedings that now hopefully are used as a tool by our sponsor, by us, to be able to promulgate this information further. If we truly believe this is important, it doesn't end here. And I think it's important for us to realize that historically we forgot actually to signify the importance of yesterday. June 6th was the 73rd anniversary of the storming of the beaches on D-Day. Right? We should have had a moment of silence because there was heroism. And I'm not comparing us to that. Right? That certainly was heroic measures that changed the course of the world. But after June 6th came a June 7th. And nobody talks about what was taking place today on those same beaches, right? And a few miles inland. That wouldn't have happened without a June 6th, but June 7th was still devastating and a lot of sacrifice. And then June 8th was still a lot of work. And the reason I bring that up is that we signify beginnings, but as we close this get-together, let's remember that the work doesn't stop. That when it comes to medical countermeasures, when it comes to the health and safety of our nation, when it comes to the national security of our beloved country, the work doesn't stop. So again, thank you so much for everything you have brought to this. I think, Laura, we have gone through the question about the happiness and all that, right? I don't need to do that. So I will end with just a simple thought. And that simple thought is, let's remember this moment. How this fills into your top 10 list, 20 list, 100 list of achievements, it's somewhere there. But you've walked away with something to our world. You've walked away with a positive. And sometimes we in public health forget to spend that moment saying things like, damn, I'm good. Darn, I've really made a difference. Let's give ourselves a round of applause, because damn, we were good. Thank you. Those of you who are traveling, travel well. Anything else, Laura? Are we done? Oh, the television show. And now, 5, 4, 3, we're off the air.